So gynecomastia actually is much more common than people appreciate. Probably 10% of all men have it to one degree or another. So what is it, first of all? In the male chest, sometimes there'll be an excess accumulation of fat in the lower portion of the chest and a stretching out of the skin. And very importantly, a loss of that nice border along the pec muscle. People work out really a lot to try to get that. But when you get that accumulation and that curve, then that becomes more of a feminine chest. And that can have some real effects on people where they just feel so self-conscious that they don't want to go to the beach and take their shirt off. They don't want to swim. Sometimes they don't want to go to the gym. Sometimes they even adjust their posture to try to camouflage it. So how does this come about anyhow? Well, there's different reasons. Sometimes there's hormonal reasons. Sometimes there's medications. Large amounts of marijuana sometimes correlate with it. Sometimes there's familial patterns. Most of the time, there's no pattern that we can really figure out. And the good news is it can usually be treated quite easily from the patient's perspective. You don't want to put scars and cut things away, but we can just do this essentially with a combination of two different technologies. The first is good old-fashioned liposuction that we use to break away the fat and any fibrous tissue in the area. But the other thing is that you want to then tighten up the skin. So I'll use a radiofrequency tightening device like Body Tight, tighten up the skin with that, and really work on defining that pec border, because that's so key to getting a good male chest.